50 years ago, the first recognized Ebola outbreaks occurred in Central Africa. Now, the Democratic Republic of Congo and Uganda are facing an outbreak of Bundibugyo virus disease, along with challenges that highlight enduring lessons from Ebola's history. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Jean Nachega, a professor of infectious diseases and the director of the Biomedical Research Institute at Stellenbosch University in South Africa, and an associate professor at the University of Pittsburgh School of Public Health. Dr. Nachega has co-authored a perspective article about historical accounts of the discovery of Ebola virus and modern lessons for preventing and controlling outbreaks. Dr. Nachega, as you write in your perspective article, the first recognized Ebola outbreaks occurred in 1976. What steps were taken by local clinicians, public health workers, and communities to support pathogen identification and outbreak control at that time?
The timing is important now. We are approaching 50 years since Ebola was first recognized in 1976. So this was an opportunity for us to reflect on what 5 decades of experience have actually taught us. And the step were the pioneer at that time, Professor Jean-Jacques Muyembe, one of them investigating a mysterious disease, unexplained disease, and try to identify the source. And through a collaboration with the Institute of Tropical Medicine in Antwerp, with Professor Peter Piot, they've been able to get some sample from Zaire, now called the Congo, and to be able to try to identify under electronic microscopy a filovirus type pathogen. And later on, with the collaboration with the U.S. Center for Disease Control, this was proved to be an Ebola virus from Zaire species. So it's quite remarkable, that type of collaboration from the field to the bench with really North-South partnership. That was remarkable.
So you say in your article that recognizing the importance of that collective achievement, of that collaboration, provides important lessons for outbreak response and preparedness, including the importance of focusing on equity before outbreaks occur. So how can equity be advanced through international partnerships and local investments?
I think that's an important point that we want to point out in our perspective. We have made remarkable progress against Ebola disease caused by Zaire, including vaccine, therapeutics, diagnostic, and ability to conduct rigorous clinical trial during outbreak. But the current Bundibugyo expose an important asymmetry. Those advances have not translated into equivalent license countermeasure across pathogenic Ebola virus. So our perspective, therefore, asks a broader question: have we learned only from biomedical lesson of Ebola, or have we also learned the lesson about trust, equity, local scientific leadership, community partnership, and sustained preparedness? So those are the aspects we want to highlight, that discovery, it's more than just discovering the virus. Really, it involves, institutions, trained people, functioning laboratory, research platform, community relationship, and those equitable partnership in recognition during outbreak.
Speaking of community relationships, you also talk in your article about the need for community trust, which is the focus of another new perspective article by Tonen-Wolyec and Bélec. How can trust in public health institutions be built and sustained, particularly in settings that are characterized by insecurity and displacement?
So this is a really challenging point. As we witnessed during this ongoing outbreak, early on, treatment centers there've been some experience of physical violence, and some treatment center being put on fire. So basically, the community, there is really critical need of risk communication and community engagement early on. Obviously, everything happened so suddenly, so maybe that kind of engagement of the community did not have time to take really place. But isolation is epidemiological essential because it interrupts transmission, isolating cases. But we sometimes discuss it as something merely a technical intervention. For a patient and family, isolation can mean separation at the most frightening moment of illness, inability to provide customary care, restriction of family contact, and potentially losing control over barrier practices. So community therefore need to believe that entering an Ebola treatment center offers something meaningful in return: excellent support care, dignity, communication with family, safety, and whenever available, effective treatment. So when that perceived benefit become weak and trust in an institution is already fragile, the social contract underpinning isolation can break down. So all those issues need to be worked out very carefully through risk communication, community engagement to minimize any kind of a downside.
Given the lack of approved vaccines and therapeutic agents, what steps do you think are going to be necessary to control the Bundibugyo virus disease outbreak now?
I think political commitment and mobilization of our resources just to try to identify cases, isolation, contact tracing, and supportive care of high standard are really critical. So all those steps are being kind of a scale up as I speak now. I just returned from Democratic Republic of Congo about 4 weeks ago, and I really witnessed really this is a work in progress, and we are not yet there yet. There's still quite a huge amount of work. Community transmission is still ongoing at a significant level. And the good news, we have now both experimental treatment that already started about a few weeks ago. One is the Ebola trial, and the other one is partner trial. So Ebola trial is an experimental oral antiviral pill or Bélec as a post-exposure prophylaxis to prevent Ebola infection after high risk. This is going to determine if taking the drug soon after exposure can stop asymptomatic individual from developing Ebola virus. So this is important. And then the partner, which is stand for Adaptive Randomized Platform Trial for New and Repurposed Filovirus Treatment, going to evaluate antiviral drug for Ebola and the related viruses, mainly two drugs, MBP-134 and the remdesivir. So this is encouraging because family of patients, at least they can be provided that possibility of experimental treatment helpful. And that will help also communicating that there may be some benefit brought up their disease one at the treatment center to give them the chance of not just having a supportive treatment, but some promising treatment that may be of help.
When do you expect to see results from those trials?
So this has been really on fast track. I think it's just a matter of a couple of weeks. We'll be able to have some interim result. So this is really important to communicate at this stage, and it brings really hope. Just to let you know that both trials are being conducted in the Democratic Republic of the Congo in collaboration with various partners. We'll just cite the WHO, the Africa CDC, while the operation on the ground are led by the National Institute of Biomedical Research in Kinshasa, led by Professor Muyembe and Professor Placide Mbala, who are my collaborator for several years now on this emerging and re-emerging pathogen. Not least to not mention also the humanitarian NGO, Alima, who, when I was in Bunia, they were very active at Rampalo site.
And then looking beyond this outbreak, how over the longer time frame can governments and public health institutions be better prepared to conduct surveillance and to administer countermeasures during outbreaks?
I want to be clear here. This outbreak, the way it's just presenting and the number of cases and deaths just keep rising. So as I mentioned, we're not yet at the level where the transmission, community transmission is being stopped. So as we ramp up, scale up the response, so we are hopeful that over several weeks, cases will start to come down. But all it will depend how effective that response is going to be. We don't want to get to the level in terms of size and morbidity mortality of the 2016 outbreak in West Africa, which, as you say, take about 3 years and about 11,000 deaths. So we don't want to get there. So hopefully with this intervention under evaluation and scaling up response, we can stop the community transmission before the end of this year.
And finally, given the recent movement away from global health investment, how do you see the necessary funding and political support to fight these outbreaks actually coming together?
So thank you very much for asking that really critical question. I know we're living now in a very challenging global funding climate, but I have to say the DRC government has been able to put in resources to try to address this epidemic, but also several partners have been coming in, including the United States, to try to contribute significant amount of dollars. So also recently, just looking at within Africa, the South African government did also announce contribution. President Cyril Ramaphosa visited about 2 weeks ago Kinshasa, Professor Muyembe, in announcing contribution from South Africa. So that type of South-to-South intra-African solidarity and in the fight, all this, I think, going to make an impact. So we really calling on all our national and international partners to come together, because protecting people in DRC is protecting the world. So I think that kind of a message has been understood both in Africa, but also in Europe and the United States. And we hope we're going to make a difference as the several weeks down the line.
Thank you, Dr. Nachega.